Hello, my name is Dr. Rashmina Balasurya. I'm a volunteer doctor at the Family Planning Association of Sri Lanka and head of mentors at Vyaka Initiative. Today, in honor of World Menstrual Hygiene Day, I'll be doing a little overview on menstruation. We'll be talking about the menstrual cycle so you know what's happening in your body, a little bit about the problems that can happen with your menstrual cycle, the products that you can use, nutrition during your menstruation, and a little bit about the hygiene, and ending with myths and misconceptions of menstruation. So now we're going to talk a little bit about the menstrual cycle. So as you can see from the diagram here, the reproductive system of the female lies in the lower part of your tummy, just in between your hips. There are a lot of components to the female reproductive system, but because of the menstruation, I'll be focusing just on the main parts involved in the menstrual cycle. So in the middle here, we have the uterus, and on either side of the uterus, we have the ovaries. Now, the female menstrual cycle is regulated by hormones that are released from both the brain and the ovary. So every month, either one of the ovaries will first release a mature egg. This egg then will travel through the fallopian tubes here, and if you have unprotected sexual intercourse and there is sperm in the fallopian tube, that sperm will fertilize the egg, which will then move down and implant on the lining of the uterus. Now, obviously, every month this is not going to happen. So when there is no sperm and there's no unprotected sexual intercourse, the egg does not get fertilized, it moves down and then has to be sent out of the uterus. Now, during the time when the egg is maturing and the egg is released, all during that time, hormones act on the lining of the uterus to make it thicker and get prepared for a fertilized egg. Now, when there is no fertilized egg and no implantation, both the egg and the uterine lining is shed, and that is what is known as menstruation or a period. Now, on average, the period is about 28 days, but remember, not all menstruators are alike, so some girls can get their period more often, some can get it less. The average length of a menstrual cycle is between 21 to 35 days. Now, when we say menstrual cycle, what we mean by that is the first day of your period, the time duration between the first day of your period till the next period comes. So that time duration should be between 21 to 35 days. That is what is considered normal. Now, on average, women bleed for about 5 to 7 days every month. So now talking about some of the common conditions associated with menstruation. It's really common for patients to come and tell us that their menstrual periods are irregular. What we mean by irregular is that you either get your period too often or too late. So if you get your period a less than 21 days gap between the first period and your next period, then that is frequent. If it's more than 35 days, then that is delayed. So irregular menstrual cycles are quite common. During puberty, it takes about a year for your menstrual cycles to get in check. Your hormone levels are still regulating and trying to find the happy balance. So it is normal for those who have just attained age and just got their first period to take up to a year for your menstrual cycles to get regular. Similarly, towards the end, when you're at menopause, again, your menstrual cycles can become irregular. So these two times of your life, your periods can be regular, but any other time as well, there can be irregularities. During this time, it is important to go and seek medical advice because there are a lot of underlying conditions that can lead to irregular periods. Things like polycystic ovarian syndrome, thyroid disorders, both hypothyroidism and hyperthyroidism, and even certain drugs can affect your period regularity. Remember that if your period is delayed and if there's a chance that you could be pregnant, it's always important to do a pregnancy test and check that you are not pregnant. Another common condition associated with menstruation is painful periods, or what is known as dysmenorrhea medically. Painful periods are expected in terms that some women experience mild cramps, and this is normal, but it should settle for simple analgesics like paracetamol or even applying a hot water bottle. If your periods are even more painful and it doesn't resolve for simple analgesics and simple procedures like applying a hot water bottle, then that is dysmenorrhea. People not only get severe abdominal pain, but also severe back pain, thigh pain. They can even faint, and this interrupts their day-to-day activities and interrupts their way of life. In this case, please go and seek medical advice, because there are a lot of drugs and treatments available to help with the pain, and you need to be investigated for underlying causes. Things like endometriosis, fibroids can all lead to painful periods. Lastly, just to touch on, I want to talk about heavy menstrual bleeding, because this is a common presentation of patients when they come to the clinic. Heavy menstrual bleeding, what we term is if you have to change your sanitary pad every hour or every 2 hours, if you're bleeding for more than 7 days, or if you're passing clots. Also, if you're tired all the time, if you get sweating and palpitation during your period, some people even faint. These are all signs of a heavy menstrual bleed. Definitely go and see your doctor if you're experiencing heavy menstrual bleeds, because they can be a symptom of an underlying more sinister cause. If you're older, endometrial cancer can frequently present as heavy menstrual bleeding, but even when you're younger, certain drugs, certain conditions like hypothyroidism or polycystic ovarian syndrome can all lead to heavy menstrual bleeding. So there are a lot of menstrual hygiene products that you can use. Now, I'll first start with cloth. Now, cloth is commonly used by women in rural communities, by menstruators in rural communities, and it's quite freely available because most people use a muslin cloth, which they unfortunately have to change every 3 months because this cloth tears. The cloth they use is comfortable, but of course there is no adhesive at the back of the cloth, so there is a chance for leakage when you get your period. Additionally, women who use cloth should know how to correctly wash it, dry it, and store it, because if you do this incorrectly, it can lead to bacterial and fungal infections that in turn will cause reproductive tract infections in those who wear it. So that's the first menstrual hygiene product. The second one is what is most commonly, which is the sanitary pad. Now, the sanitary pad is quite available freely in Sri Lanka, but of course there is it's more costlier than the cloth pads. As you can see, there are sticky adhesive surfaces to secure securely to your underwear. The only issue here is, again, it's not biodegradable, so these do tend to collect, and it's not very eco-friendly, but the price point is that it's a bit more expensive than the cloth pad, but cheaper than some of the other eco-friendly options. A great alternative is the cloth pad. Now, this is reusable. As you can see, there are fixtures here to secure it to your underwear. Remember that when you wear your sanitary pad, whether it's cloth or whether it's the disposable one, you have to change it every 4 to 6 hours depending on how heavy your period is. So if you have a heavier period, heavier flow, you want to change it every 4 hours at least. If it's a lighter flow, then you'd want to change it every 6 hours. So this is the eco-friendly option. This is a great option actually. It's a little more expensive than the disposable pad, but it lasts much longer, so it's more cost effective in the long term. Yeah, and this again, like the cloth, you have to wash it, dry it, and store it in a safe place in packaging so that it doesn't get contaminated with any infections. Then you have the tampon. So the tampon is unfortunately not freely available in Sri Lanka, but it's a great option. Once you insert it into the vagina, you push it through, and as you can see, there is an absorbable surface, and this sits inside the vagina. It doesn't go anywhere, so don't get worried, and there's a thread that comes out. So when you change it, again like the pad, you have to change it every 4 to 6 hours depending on the flow of your period. You just pull down on the string and it comes out. Now, the tampon may be a little daunting to insert at first, but once you get used to it, you don't even feel like it's there. You can even go swimming while wearing a tampon. But remember, you can't wear them overnight. You have to change them frequently, like every 4 to 6 hours. One more thing to mention is that unfortunately it's disposable and not eco-friendly. It does not biodegrade, but it is an option. It's more expensive than the sanitary pad and not found as easily in Sri Lanka. Lastly is probably the most eco-friendly option and a great option. This is the menstrual cup. There are a number of sizes that you get, pre-birth and post-birth. The menstrual cup sits just below your uterus and collects all the blood. And this can be left for a longer period of time. It's made out of medical grade silicone and is very safe to use. As you can see, when you insert it, you just have to fold it. There are different folds actually that you can use, and you insert it and it just sits underneath the uterus and collects all the blood. It doesn't go anywhere, it doesn't get lost anywhere. Every 6 to 8 hours when you want to empty it, you just pull down and you can empty the blood and reinsert it. For the first time when you're inserting it, you have to sterilize it, so put in hot boiling water, and even at the end when you finish your period, you again have to sterilize it and store it in a safe, dry place. This is an eco-friendly option because it's reusable for up to 10 years. The only downside is that the initial cost is a little higher than all the other options available. And also some women find it a bit daunting at first to insert, but thereafter it gets much easier and is a great option for your period. So talking about nutrition whilst you're on your period. When you're on your period, you're going to bleed and therefore you're going to lose a lot of iron. So it's important that when you're on your period, you do eat a lot of iron-rich foods, things like spinach, basically leafy greens, red meat, eggs, anything containing protein and iron. Additionally, vitamin C-rich foods like oranges can help absorb iron into your body, and therefore consuming this as well is useful during your period. Tracking your period is very important. It can not only help you plan your life, but it also can let you know whether your period is regular or irregular. And if there is an irregularity, then you know early and you can seek medical advice. You can use this either by using a calendar or you can use an app on your phone to track your periods. No, you can still definitely get pregnant even if you have your period. This is because sperm can live for up to 5 days inside the uterus. So you can definitely have a chance of getting pregnant. Also remember that if your cycles are irregular, it's probably not best not to have unprotected sex if you're intending not to get pregnant. You can definitely go swimming whilst you're on your period, but you need to use something like a tampon or a menstrual cup because if you use a sanitary pad, that will get soaked in the water. But if you use a tampon or a menstrual cup, you can definitely go swimming whilst you're on your period. Actually, exercising while you are menstruating is helpful, and some people actually find it beneficial for cramps and all the ailments they have while menstruating. So exercising is fine in moderation. You don't have to exert yourself, but exercising in moderation is actually beneficial whilst you're on your period. It's very important to shower whilst you're on your period. Remember, your menstrual cycle, and especially menstruation, is governed by a lot of hormones in your body, and these hormones make you sweat and perspire more. So it's definitely important, especially for hygienic reasons, that you shower at least 2 to 3 times a day in Sri Lanka with the hot, humid climate to maintain hygienic conditions. So please do shower whilst you're on your period. Actually, you should never flush your sanitary pads because remember, it's not biodegradable. They'll go and get stuck in the pipes and cause severe problems. So the best way to dispose of your sanitary pad is to actually wrap it in tissue and throw it in a bin. Period blood is not dirty blood. Period blood is just like any other blood that's released from any other area. When you cut yourself, it's the same blood that comes out. The reason why it turns color is because when period blood is when your menstrual blood actually is exposed to oxygen, it turns a brown color. So it's not dirty blood, it's not impure, it's just like in blood anywhere else in your body. Girls do not have to stay at home, they do not have to be isolated, they can go to school and go to work.